A typhoid clinic in Zimbabwe. These pictures were filmed during a 2012 outbreak of the disease that affected 1,500 people. Normally, typhoid, which is commonly spread in contaminated water or food, can be treated with antibiotics. But a new super strain that resists most antibiotics is spreading around the world. And as more and more infections become drug resistant, it's worrying health experts.
The World Health Organization has warned that we're heading towards what they call a post-antibiotic era, meaning much of modern medicine could become impossible, from common surgery to chemotherapy for cancer patients. They've also raised the prospect of infections that used to kill millions of people here in Europe, like tuberculosis, becoming a danger once again.
Now a UK-based initiative wants drugs companies to invest $2 billion in researching more effective medicines. Their prize would be large one-off payments if they successfully develop the most needed antibiotics. The money would come from governments worldwide, costing up to $37 billion over 10 years. A hefty sum then, but the man heading the project insists that ignoring the problem would be more expensive.
We've estimated if we don't do these kind of things, it's going to cause world GDP to be $100 trillion smaller than otherwise would be the case in 35 years' time. So, as a person that's thought of risk versus reward for much of my adult life, $37 billion, as big as it sounds, it is nothing.
The idea would also remove the commercial incentive for drugs firms to sell as many antibiotics as possible. That's important because the more the drugs are used, the more the bacteria become resistant. But overprescription by doctors is not the only problem. Most antibiotics consumed in the European Union are actually for factory farm animals to produce meat faster and cheaper. The British government says the world needs to work on the demand side of the problem as well as supply.
We need to, first and foremost, prevent people from getting infected in the first place, and secondly, to ensure that we make very best use of the antibiotics that we've got, that we preserve those antibiotics.
According to the WHO, 3/4 of countries have no plan to deal with growing antibiotic resistance. If the new initiative can at least convince them it's a problem, many lives could be saved. Nadeem Barber, Al Jazeera, London.